Welcome to this explainer. Today, we're diving right into a truly massive development in global health. We're going to break down the massive implications of India's newly approved dengue vaccine and what its rollout actually means for public health. If you've been following infectious disease trends at all, you know that dengue has been this persistent, escalating challenge. But recently, we had a major milestone that could shift the landscape entirely. Let's get right into the data, the science, and the strategic rollout plan to make this breakthrough crystal clear.
To really grasp the stakes here, we first have to recognize the sheer scale of the problem. India alone accounts for nearly one-third of the entire global dengue burden. Think about that for a second. More than 125 countries around the world grapple with this mosquito-borne disease, but a massive 33% of the global impact is concentrated right here in India. It's not just a regional issue. This is a critical epicenter for a global health crisis.
And here's where it gets wild. There is a stark contrast between official reports and reality on the ground. While official figures might point to around 113,000 reported cases in 2025, modeling analyses reveal a severe hidden crisis. The actual dengue burden in India may be significantly higher. We're talking potentially tens of millions of infections each year. So many cases go unreported or misdiagnosed, meaning those official numbers are really just the tip of the iceberg. And the trend line? Well, it's pointing in a genuinely alarming direction. Over the past 2 decades, dengue cases in India have surged by an 11-fold increase. 11-fold! That is an exponential leap. It illustrates exactly why a medical intervention has become an urgent national necessity. We aren't dealing with a static disease. This is a rapidly accelerating threat outpacing our current preventative measures.
So let's move to Section 1, the solution. Qdenga arrives.
Let's dive right into this medical milestone. The vaccine is called Qdenga. It was developed by Takeda, and it marks the very first time a dengue vaccine has cleared regulatory hurdles in India, having been officially approved by the CDSCO. This is a historic moment, bringing a preventative tool that simply hasn't existed in the country's public health toolkit until right now.
The crucial point here is understanding who can actually get this. The eligible demographic is incredibly broad, covering people from ages 4 all the way up to 60 years old. But the absolute game changer is that it's approved for people who have been previously exposed to dengue and for individuals with 0 prior exposure. This is massive. It means the vaccine covers a huge portion of the population, regardless of your past medical history with the virus.
Moving on to Section 2, how Qdenga works.
You know, dengue isn't just one single uniform virus. It actually comes in 4 distinct variations, or serotypes. They're creatively named DENV 1, 2, 3, and 4. What's brilliant about Qdenga is its comprehensive design. It induces a strong immune response against all 4 of these serotypes, targeting every known variation to generate a really robust immune defense. And getting it is a straightforward 2-step process to ensure maximum efficacy. You get a first dose of 0.5 milliliters, and then, exactly 3 months later, you go back for your second dose. It's a nice, simple schedule for healthcare providers to track and manage.
Which brings us to Section 3, the implementation and the 2027 rollout strategy.
So we have the regulatory approval right now in the present, but Takeda's expected timeline actually pushes the market launch in India to early 2027. So yeah, we are still a little ways out from seeing needles in arms. Looking further down the road, there is the potential for this to be included in national immunization programs, which would dramatically scale up access.
Let's zoom in on that early 2027 launch for a second. We have an official statement from Peter Streibel, the general manager at Takeda, confirming exactly where the vaccine will first appear. He notes that following market authorization, the vaccine is expected to be available through private healthcare settings, so the initial rollout will be concentrated entirely in the private sector, rather than public clinics right out of the gate.
And a private launch brings up a major, lingering unknown: the price. Right now, the pricing of the vaccine remains totally unclear. Because it's launching privately first, whatever that cost ends up being is definitely going to dictate who actually gets early access. It could mean this breakthrough initially only protects those who can afford it out of pocket, keeping it out of reach for millions who remain really vulnerable.
Now, Takeda acknowledges this reality, and their ultimate goal is broad public access. To get there, they're using a parallel access strategy, pushing simultaneously across private markets, endemic areas, travel markets, and eventually public markets through national immunization programs. But, and this is a big but, bringing this to public markets takes time. It depends entirely on independent decisions by government health authorities. It's a much longer, complicated bureaucratic road.
So, as we wrap up this explainer, we are left looking at a pretty critical tension. On one hand, we have an incredible scientific achievement ready to tackle a massive public health crisis. On the other hand, we have an initial rollout confined to the private sector, with an unknown price tag. With a private launch set for early 2027, how quickly can Qdenga actually reach the tens of millions of people who need it most? Keep that question in mind as we watch this historic rollout approach. Thanks so much for joining me to explore this crucial milestone.